call the February board meeting of the Lee County Board of Education to order, and I will offer an invocation. Please bow with me. Father, we thank you for the opportunity that we have tonight to discuss the business of the Lee County school system. We thank you for the trust that you have granted us to lead this system as policymakers, and thank you for the staff and administration that we have. Father, would you grant us your wisdom and discernment as we deliberate tonight and as we take in this information. May the decisions we make be the best for our students, for their parents, for this system, and for our county. In Christ's name we pray. Amen. All right, you have the agenda before you. We can adopt it by consent. All right, and the minutes for the January 19th, 2021 meeting were presented to you in the package. What is the pleasure of the board as it relates to those minutes? Have a motion by Ms. Lane. Is there a second?
Second.
Second by Mr. McDowell. Is there any discussion?
There was a change in that third paragraph, I believe 10 percentages. So
Yes.
with the change,
Okay. It just didn't make it into assembly. The change didn't make it into assembly. Okay. Okay. All right. Everybody aware of that change? Saw the email about that. Okay. Hearing no other discussion, all those in favor, let me know by saying aye. Aye. Any opposition? Passes 5-0. You have the consent agenda before you. It looks pretty regular. Dr. Miller, would you like to address anything on there?
It's fairly routine for this time of the year. There's 6 recommendations for employment, 4 reassignments, 6 resignations, 4 retirements, 1 termination, 4 out-of-state field trip requests, and 3 requests for fundraisers.
What is the pleasure of the board as it relates to the consent agenda?
Accept.
Have a motion by Dr. Newell, a second by Ms. Lang. Is there any discussion? Hearing none, all those in favor, let me know by saying aye. Aye. Any opposition? Passes 5-0. Dr. Newell, you're up with your reports.
Yes, sir. First, I'd like to report on SPLOST. We had a great January. The collections came in at $406,686.99, which is the highest total ever for the month of January, and only the 3rd time that we surpassed $400,000 in collection. Those other 2 times were November 2006 and May 2020, and I took out the month where we got the reimbursement from the state. But that's really good news with our SPLOST collections. Food service, you have a copy of their report. For January, we fed students curbside the week of January 11th through 15th and served 1,593 breakfasts and lunches to parents at the pickup sites were the 4 K-5 schools, so both primary and both elementary. And I'd also like to note that our staff at East, West, 9th grade, and LCHS helped make that happen. We appreciate their support. And I would like to thank the staff of Twin Oaks Elementary School, and I mean teachers, administrators, food service, administrative staff, even Mr. Holt, who's been on trash duty, carrying out trash. The cafeteria staff, most of them were taken out through exposure and are having to quarantine, so we've kept lunch and breakfast going, and I think it's been an adventure. But I commend our leaders in food service, administration office up here, and also Ms. Peppers, Mr. Holt, and the teachers and staff at Twin Oaks for keeping that going. Student health services, with a delay in starting 2nd semester last month, our numbers are down a little bit. We had 1,228 clinic visits, which is lower than normal for the month of January. I'd like the board to notice that in the totals column on the right, you see that daily medication is by far the highest total for the kinds of visits that our nurses have. And you can also see in the 6th column, in the 6th row, you see that the we also have teachers and staff who go down and see the nurses, so they not only serve our students, they're helping our adults as well, and that's very important. Could be many things like a blood pressure check or medication or just a consultation, and we thank them for the work they're doing.
A question.
Yes, ma'am.
On that top line, on the daily medication,
Yes, ma'am.
there's one of the schools that double everything else. Is that an error?
On the top line, on daily medication, had 0. Yes, I would think that would be an error.
It looks like it's an error to me.
Yes, ma'am. But I will say probably
The
that.
one that's at 180. You're talking about the one that's at 180 versus the other one.
Yeah, that's probably some type of error. Now, I will say there's some children in that school who have a medical condition that requires more frequent visits, and that they have a higher number of students in that particular category than the other schools currently do. And so,
So if each child goes every day to get a shot, that's
well, let's take diabetes, for example. If they're doing a finger prick or to check their blood sugar, and now the technology is such that a parent can, most of our students who have diabetes wear a continuous glucose monitor, and so the parent can see that reading on their cell phone, and at such a young age, they're going to be more up and down than an older child, so they're going to be going down to take treatment for a low blood sugar or to consult with a nurse about additional insulin. So that may be part of that. It could be, probably Ms. Ford's right, it's an error, but I'll ask
It's
about
just,
that.
it's just kind of a standout.
Yes, ma'am, well, thank you for pointing that out. And technology, I would like to just say a few words here about our CARES funds. We received $2.8 million in CARES 2 funding, and we plan to use some of this funds to increase technology in our schools. Our goal is to have enough devices to provide technology at a level where each student would have a device available. Right now, when we do state assessments, we have to stage it over several days. Am I correct, Ms. Mary? Because we don't have enough devices to touch all the kids at the same time. So it makes the testing go much longer. And what we essentially want to get to is almost like a set for each class, would be one way to describe it. You might say 1-to-1, but not in the sense of we're issuing devices for people to take home. We believe this is a great opportunity for us to get caught up, and it's a need in our system that we've had. And, we not only have to, be ready to do this, it requires a great deal of planning because it's not just purchasing the technology, but also supporting it and sustaining it so that it can go on indefinitely, because devices, typically a Chromebook lasts about 5 years and then it needs to be replaced. And so we have to plan ahead to do that as well as to keep it serviced. So we think this will really move our system forward, and we believe it's going to be a good expenditure of some of those funds. Obviously, the state has asked that we tailor the money as well to loss of learning, which is the idea of, we missed 42 days of school last year due to the shutdown in March, and so to make up any deficits or gaps, that's also what the CARES money will be used for.
I was just listening to the radio.
Coming in, and I heard the president say something about requirements for some federal dollars to include air filtration system updates in certain public schools. Have they sent any mandate down for that kind of thing?
No, sir. I believe that's a reference to this, the next round.
The next round?
Yes, sir. And we have no idea what that's how much that'll be. We have explored that and are looking into that for our system. It would be very expensive. We have over 1 million square feet of heated and cooled space, and many of our classrooms have individual units that we would, it would be a major undertaking. We consulted with a provider, this summer, and, we didn't, go forward because we just didn't have the funding. Our first round of CARES was about $600,000, and that would not come close to touching that kind of project. And then by the time it would have been, we didn't think we could get it done in time to use it this school year, but we will keep that option open.
Quite, the president's mandating it, or
No, it was
he's
just
offering?
some of the requirements for this new round, I guess.
Are we considering doing it?
Putting an infiltration system in all our schools?
Well, we'll see what the requirement is. For example, this current round says that we need to address loss of learning, and that can be many things. It could be summer school, it could be after-school program, tutoring,
Mhm.
and so we're planning to address that need as well as the technology. Because one of the challenges we have is having enough devices for every single child to be able to use. So we're working on that. And then we'll see what this new round, if there is a new round, I know there's some, it has to be approved.
That's like down here, but, okay.
Yes, sir.
I think I understood that the CDC is issuing reopening guidelines too, within the next week or so. Are y'all anticipating anything major with those guides coming?
I'm not aware of anything, but that doesn't mean something's
I'm
not
pretty sure I
coming
heard it
forward.
along those same lines from,
I read an article last night from the National Association of Elementary School Principals about CDC guidelines. I did not see anything different there than what we're currently doing. Now, there's other things out there with the coming of vaccinations, and some schools are looking at other things that we've not really done before, like testing. You hear so much about it with the athletics that are going on. One of the NBA's biggest players got pulled in the middle of a game. I was watching the game, and he played the first half, and they took him out because of a possible exposure, and he had to go through a lot of testing to come back. And so that's something we've had some discussions with DPH about, but it's not gotten beyond that. And I'll say a little more about that. Transportation, as you know, we're facing a shortage of drivers. We currently have 10 drivers and monitors out. We've had to double some routes. We want to thank our parents and families and students for being patient, because some kids are getting to school late and staying late before they can, the drivers having to drive a route, come back and go back. And so we've asked, we got about 18 certified staff who have their CDL, and we've asked for their help, and I'm proud to say they've stepped up, and we're able to get through this week. And by the end of this week, most of the drivers will be back. We'll be out of school Friday. We'll have a virtual day, and everyone will be out Monday. So that little breath of break is going to get us through. As some have said, our ox is in the ditch, so to speak. And again, Mr. Holt, not only is he taking out trash at lunch and being an assistant principal, he's also driving the bus. So he's filling a lot of needs for us, and we're thankful. Mr. Hank Wright, assistant principal at the high school, he stepped up last week and covered a route so that we could get everybody home. And I thank the drivers and Mr. Haynes for his leadership. There is a discussion and action item related to transportation in a little bit.
Please express our appreciation to all those folks.
Mm-hmm.
Yes, sir. Wow, they've been great, and we're very thankful to have such outstanding people. We will take delivery of 3 new buses next month that were ordered. We got some funding to purchase some new buses to keep our fleet up to date, so that'll be next month. Finally, plant operations has a PowerPoint. Can you pull that up, Jennifer? And we won't spend a lot of time on this, but I appreciate them preparing this.
Who?
Plant operations.
You're in December's meeting.
Yeah.
I was looking at
past student health services.
So this isn't live for the public to see, we're not live, we're just recording.
We're live.
We're live, are they seeing this too?
No.
Okay.
Okay, we'll scroll down. In particular, I want you to see the work going on at Twin Oaks Elementary. And here's a report on many things that they're doing. You can see here on the right, this is the new awning. The exterior doors of the gymnasium, water would back up and come in and damage the floor. If you go in that school and walk to those doors, you'll see the floor is buckled right there. So this type of awning is gonna provide protection from that and additional space. You see the pipe in the middle of the wall there. There'll be an outdoor water fountain when the students are outside at PE or recess. They have to go back in the building to get to a water fountain now. And this will be a nice enhancement. This is based on the plans that were used for building Lee Elementary School. And this project's proceeding well. Also, a drive to the left of the gymnasium was put there. That's one of those where there was no grass growing because the trucks have to bring the materials for the custodians to use as they clean the schools, and so they pull right there to that entrance. And so there's a nice drive that will allow them to access that area, as you can see. And we updated the technology for school safety, the key, the card access, and new doors went in at both pre-K and the 9th grade. We cannot use the card access because the doors were so old. And we actually had, a person that was not supposed to be in the building came in the building. Everything's fine. There's no danger to anyone, but that prompted us to make sure and replace those doors. Because they're put there in 1954 or 5 when that school was built. And then just some of the training with the staff. I think that's,
A little bit further down
Yes,
that,
ma'am. Yes, ma'am.
in looking at this, I need some sort of a key to what all these codes mean, because I don't know what a tier 1, tier 2, tier
Okay.
3 is. I
Yes,
don't know
ma'am.
what a QT1 or a CT1, I don't know what all that means, so.
Okay, that's a good point.
She don't know, I definitely don't know.
Yeah. Well, we'll get Mr. Rash to send that to us.
I mean, that's a lot of information.
Mhm.
It's just not clear to me what the information is. So if you can put a
Yes, ma'am.
key in there or something, just so that I can understand that right.
Yes, ma'am. We can do that. But you see that, they have these work requests and you're getting them taken care of.
All right, any other questions for Dr. Miller?
We'll move on to discussion and action items. Mr. Landry, I believe you are up. Yes.
Okay, just to give you a little update on the strategic planning. As you know, we've entered into a contract with GSBA, which is the Georgia School Board Association, as you're probably pretty familiar with. So I have been talking a lot with Lanita Jackson, and she's great.
She's awesome.
She's awesome. So she is giving me very good guidance as to what to do. So where we are at this point is February 22nd, 5 o'clock. You'll all be here because GSBA, both consultants will be coming to present to you all just kind of the purpose, kind of an overview, and that'll be a time for you all to give your input on what you see as strengths, weaknesses, opportunities, and threats for the system. And so they will work through that process with you all to get that information. And then we have decided to do the community engagement piece with the focus group
on Thursday, February 25th, and that will be virtual. Just with everything going on with COVID and trying to figure out a facility that was big enough to try to social distance, the only way we could really move forward right now at this time was through the virtual. But we are kind of excited about it. We feel like that's actually going to bring more people to the table. So we've had each school reach out to parents, community members, our community partners, as well as a teacher from their school or their program. And all of those individuals will start out in a general session. Dr. Miller will provide a greeting for them all, and the GSBA will pretty much take over, and from that focus group, find out what they think in breakout rooms, their strengths, weaknesses, opportunities, and threats. And then at the end of that meeting, everyone will be sent a document that shows everything that was discussed, and they'll be able to determine their top three, kind of rank their priorities.
And that was
And
what-
you'll do that as well.
That was on Thursday, the 25th, at what time?
That's just a virtual meeting. You don't have to be involved in that one. That's just for the community focus group. You'll be doing yours in person on Monday, February 22nd at that planning meeting.
Could we observe that meeting? Or-
I'm sure you could. You could be definitely in that general session. They just asked that the facilitators be administrators from the schools
Yeah, I don't know.
for it, but you're welcome to hang out. I'll send you that link.
Okay.
And then after that, they will do there will be a survey that goes out to everybody in the community for a 2-week period of time. So anybody that would like to participate will be able to. Of course, we'll send that out through a blast, and we will highlight that big time because Ms. Yolanda is going to help me with that to make sure we get the word out. And so we should have pretty good participation, I think, with that aspect of it. And so once they do that, the GSBA consultants will then prepare a community engagement report. In addition, they will have a meeting with district leaders and Dr. Miller to kind of talk about the data. What is our test scores, formative assessments, failure data, discipline, you name it, all of that. And we will utilize our balanced scorecard as well to kind of show the state of the union. And then they'll help us kind of work through that aspect of what they're seeing, things that are highlighted with areas we need to work on and things that we're doing well. After that, we will move into, it'll be probably March, when we'll move more into the planning team meetings. And that is where it'll be a smaller group that'll be facilitated by GSBA to work on whatever those strengths, those top strengths, weaknesses, opportunities and threats, to determine goals that we need to work on for our system. And so that is also a place where you can have up to 1 to 2 board members. And that will be in person. It'll be a smaller group, probably about 20 or so, 25. And I think we'll be able to do that, I feel like, at the bindery maybe. I'm going to reach out to them once I get more information from GSBA of when they would like to do that. So we're rolling along, and I think it's going to be very informative. I'm excited about the process. I think we're going to get a lot of information from our communities, stakeholders, as well as our internal stakeholders, and I think we're going to get a good idea of what we need to focus on. So.
Sounds like a great plan, and I know the GSBA has a, standard schedule, but could you put that in an email to
Yes.
us so that we'll
Yes.
know in what
Sure.
parts we can observe or participate in? I know we can figure out who wants to be a part of the 1 to 2. I know we have to avoid sunshine law violations and those kind of things, so.
And when they come on the 22nd, feel free to ask any questions that you have, whatever you are concerned about. That will be a time for you to have a very open and honest conversation with the consultants, and it will just be you all. I mean, I'll be, but thought, really, one of the reasons why we moved that community engagement piece to a different night was because we wanted to give you all enough time to really think through what you need to think through with this process. So,
Is there any homework we need to do before then?
Before the 22nd.
Good question. I would say,
look at the balanced scorecard, and I can share that with you,
Please do.
that link again. Just know that some of that data, obviously, we haven't been able to do milestones, so, but you have the trend data, you will be able to see that. And of course, if there's anything, I could probably send you tons of things, but I don't know how, I don't want it to be overwhelming, you know, with just 5,000 pieces of data, but I will definitely send you the past documents where I have different things linked so that you can look at all of that. And if you have any questions, feel free to email me or ask.
Dr. Newell?
So I was kind of like, same thing he was asking, but a little different. I would like to be prepared for that meeting and to know what questions to ask. The only way I know how to do that is if you send me something to
Okay.
tell me where we fell short,
Okay,
or where we hit the goal, or we exceeded the goal on the last
okay.
strategic plan. Because, I mean, I'm sure some of that will overlap,
It sure will.
I would imagine. And, you know, if I could just say, hey, this was our strategic plan and we didn't do this.
The balanced scorecard will help. and I will-
And it may be that scorecard, I don't know.
Will it make up, or will there be clear indications as to what impact the lack of milestones or the lack of those things that we,
At this point, we're still gauging that. I will tell you, one of the things that we have going for us is that our schools are still continuing with formative assessments. And so quarterly, we are looking at that information, and I can share those quarterly meetings that we're having to look at that data. We're piloting some things as well this year. I'm sure, you've probably heard, or I probably mentioned it at some point, but the state has come out with a new formative assessment platform called Beacon that is available for grades 3 through 8 for ELA and math. So our elementary schools and our middle schools are working with that this year, and that's giving us some very good information. We started a little slower at elementary because, well, first of all, age of kids and that type of thing. But they are, basically that platform is the same platform that we do the milestones testing. And so it's set up in much the same manner. So it's helping us with a lot of different things, but it's also set up where you can give a test 2 to 3 times a year. That's called an interim assessment. It's kind of like a benchmark that covers all the standards for ELA and math for that particular grade. But it also has these little testlets that are very short, 15, 20 questions. I keep looking at Mr. Holt because they've been working with it a good bit since December. And so those are very short and are giving some pretty good information they're finding with their students of how well they're doing over different domains, so over different standards that they've already taught. And that's been very informative to help teachers determine where do we need to go, what have they learned, who needs remediation, who needs acceleration, or are they near their target for the year. So we are finding some success with that. So all of that said, that should help too. It's not like we don't have any of that kind of
Right.
data. We've got something we can go on.
random off subject, but is that gonna help with the loss of learning conversation that Dr. Miller was talking about earlier, that the state is now
yes,
looking into? Okay.
yes, they have,
That's part of what the teachers and on the leadership teams and the administration in the last month have been talking about to try to determine, we know we have gaps based on the assessments we are doing, so what can we do to help the kids? So each level has met and determined different things that they think they can do, and that's where he's gotten that information about the, regarding the after-school programs, summer schools. So for example, primary right now does not have a summer school, but we're looking at a way to try to work through something of that nature with some of our students that we know are struggling. Same thing at elementary and middle school levels as well. High school, is a little different because it's credits. But they have put several things in place to try to work with kids that are struggling, including some boot camps that they've done at the end of last semester, and they plan to do that again this semester. So they are very much on top of it, and trying to use every piece of data. We're still doing universal screeners, and our universal screeners are able to be done with virtual students, so they can be done remotely. So we're getting those pieces of data that we can track and see where kids are at different times of the year, in addition to just the day-to-day quizzes, tests, those types of things that the teachers are administering. So I think I must say, given all the challenges of this year, I'm quite proud of all that they are trying to do and stay on top of. It's overwhelming, I'm sure, but they have done an excellent job trying to make sure our kids are getting what they need, so.
Thank you. Any other questions for Ms. Pender? You got off easy tonight.
Yay, thank you.
All right. Will you please send us that schedule?
I sure will, I sure
If
will.
I could, while I'm thinking about it, send it to my bank email address, please.
I sure will.
Thank you. I can't use the
Could you-
documents because I don't have.
Send it to yours.
My other email
Yes,
address?
I will.
Because the Dominican, I can't, I have a problem with charters. I can't check my
I'll
email.
Send it to both, so you have
That's
it in all
perfect.
places.
All
How
right,
about
thank
that? Not a problem, I'll do it.
Dr. Miller?
I'd like to take this opportunity to give the board a brief pandemic update. I've tried to do that every month, and I know we talk individually or sometimes through email, but I wanted to kind of provide a picture for the board, but also for our community of where we are with the pandemic. This will be very brief. As of this afternoon, we have 24 students, staff who are positive for the virus. 382 students or staff in quarantine. We are experiencing, as noted before, a shortage of bus drivers and in particular substitute teachers. There were some approved tonight by the board in the consent agenda. We encourage anyone who has an interest in substitute teaching. This is a great opportunity for people that need a flexible schedule and would like to make a difference in schools and earn a nice check. So we're feeling the impact. Our community numbers are better, but one of our parents emailed me and asked me what our totals were. And I thought that was a very good question, and it's something I've thought a lot about, but we had not taken time to track them. But as you can see, as of last Friday, we had 322 students and staff that tested positive for the virus. 2,724 students and staff in quarantine. Now, the quarantine numbers may be off because sometimes students have quarantined or staff have quarantined more than one time. And so that doesn't mean 2,724 people have been in quarantine. These numbers go back to July, basically when the athletics began, when we were allowed by the Georgia High School Association to bring students in for softball. We brought in marching band, we had band camp, we had football going, and that's really when we started tracking this data for our school system. So it does cover 7 months' time. I'm proud to say that we recently celebrated the 100th day of school, and most of those days have been in person, and I'm very thankful for that. We've been blessed with great cooperation from our students and our families, and I particularly want to highlight the work that Susan has on the academic side, but our teachers and staff to make this possible. As of this afternoon, the Georgia Department of Public Health COVID website indicated that Lee County had 1,497 cases to date of the virus. That represents about 5% of the total population. When you look at our number of cases for the virus compared to, we have about 7,300 students and staff connected with this school system. We're about 4%. So, you know, we more or less reflect the community numbers at a little bit lower level. Jennifer, can you pull up that DPH website? This is something I look at every day, and so do a lot of other people. If you scroll down, whoop, yeah, scroll down, okay, keep going to the map. There's a map of Georgia, and you can hover over Lee County. Right, yeah. And you see 1,497 cases. Now, our Department of Public Health in Georgia doesn't report the antigen cases. There's another website called COVID Act Now. This afternoon, they had Lee County, the community numbers. We were number 49 out of all the counties in Georgia in daily new cases per 100,000. We were number 97 in infection rate and number 59 in the positive test rate. So our numbers are trending in the right. Today there was one case. Now Mondays are always, you know, much lower because of the weekend effect, but there was only one case for Lee County, which is great news because for a long time we were seeing double-digit number of cases in the county. If you go down a little bit, Jennifer. Okay, there should be one more. No. There it is. Okay, click on children only. See that? Yeah. You can see we've had a pretty good decline with that 10 to 17 age group. You see that peak around the 1st of January. But you will notice that our 5 to 9 age group has actually seen a little bit of an uptick. This is for the whole state of Georgia, not Lee County. But I find that interesting that our younger students, right now, the school with the most cases is one of our primary schools. That's been unusual because we went from August till December. We had a case early on in August at Kinchafooney and not another one until December, right before the Christmas break at that school, which is, you know, which reflects the research that the younger children don't seem to get it. But I do find it interesting where the other age groups are going down. We just had a little uptick with our 5 to 9, which is kindergarten through about 3rd, maybe 4th grade. And for the state,
Right.
again, that's not just Lee County.
Right.
I do not know what that means. I'm not an epidemiologist or a doctor, but I believe I've gotten a lot of medical, reading more so than ever in any other time in my life these last years, most people have. The 322 cases, as I said, you can go back to the PowerPoint and go to that last slide. Yes, looking forward, can you make that bigger? Thankfully, our community numbers are improving. Again, we're grateful for the support and advice of many, including the Georgia Department of Public Health, the Georgia Department of Education, the Southwest Public Health District, and if I may say, Dr. Ruiz I've been on the phone with him at 10 o'clock at night. If I ever have a question, he's wonderful about responding. He's our district health director. Phoebe Putney Hospital and many other trusted advisors have helped us walk through this. One area that's causing a little bit of confusion right now is the CDC recommendation for quarantine. You know, they came out and said that you could end quarantine after 7 or 10 days, 7 days based on a test or 10 days. Lee County as a school system is continuing with the recommended 14-day quarantine period, because if you read the guidelines, it says that you can end quarantine 10 days if you wear a mask and you remain socially distant. And we cannot do social distancing in the school setting, having school. certainly, if the child can wear a mask, I mean, that's no problem, but the social distancing is a real catch for us right now. We're gonna monitor
When the
this.
child returns after 10
Yes, sir,
days.
meaning after 10 days when they return. And I know that's a frustration for our parents, and a difficult thing, but it's kind of the price we have to pay. Our quarantine has worked. Most of the kids who've been quarantined did not get sick, that we can tell. There have been examples of that, but one thing I'm proud of is that, we've not had any clusters, and that's what we want to avoid, having a spread, a number of cases in one school that are all connected. And we've been able to avoid that to this point, and we feel like the 14-day will help us. One concern we have looking to the future is the variants. I had a conversation with V.B. Putney last week, and that's something that they and many healthcare leaders are concerned about, is these new variants that are already present in Georgia. I don't know that they're in our area yet, but something to keep an eye on. We have to maintain our vigilance. And again, I just want to commend our students and families for their hard work and diligence in maintaining their vigilance. We are going to modify our temperature checks. Right now, they're daily. We plan to move to twice a week, beginning next week. And if our numbers continue to be good, we'll move forward with that. Right now, we are surveying our staff. We should have those results tomorrow. The Department of Education asked us to gauge how many of our staff will participate in vaccination. Our staff who are 65 and older, many of them have already started that, or who have an elderly parent in the home, or caregivers. We've had several that have already started that process. And we are communicating with the state regularly. We get great support, as I said, from the Department of Public Health and the Georgia Department of Education. And we look forward to time where hopefully we can have all of our teachers and staff vaccinated, so that we can ensure their safety in the school setting for those that choose to participate in the vaccination process. Do y'all have any questions, or you want? Yes, sir.
I have a few.
Dr. Newell? Yes, sir.
All right, I want to go with this. Nobody can answer this question for me.
Yes,
I've
sir.
asked it a couple times. Looks like we have 9 to 1, roughly, that are quarantined over a virus. Why is it still so many people are quarantined when you yourself, and that was the next question, say that the people quarantined aren't getting it?
Yes, sir.
And that's 2,000 kids that are out of school because they potentially might could catch a virus if they were in the room with somebody. I'm trying to figure out, the whole point of contact tracing is to eliminate, to get that number from 9 to 1 to 1 to 1, if you can, or 1 to 2. If we're staying at these 1 to 9 numbers, are we looking at things to stop from it being 1 to 9?
Well, yes.
And how many of the kids quarantined are getting it?
Well, as I said, it appears to us that very few are getting it. The transmission of the virus seems to be more related to the setting that the child's in, and that setting's away from school. Even the CDC's researchers reported that. However, the number's going to vary based on the age. For example, if a child is in pre-K and they test positive, that whole class is going to be quarantined.
Is that where most of these numbers are, in the pre-K?
No, it's spread
Because
out.
I thought with the middle schools where I was seeing the
Well,
big number.
in middle and high school, they change classes.
Mhm.
So if I'm in 3rd grade, I'm probably with the same kids just about the whole day.
Mhm.
And so there's gonna be limited exposure because of that. But if I'm in a grade 6 and above, where I'm changing classes multiple times during the day, even in middle school where they're on the same team, they're not necessarily always with the same group of kids, so that bumps our numbers up.
Well, right, but I agree, but and I know y'all are doing everything possible. I'm just trying to find out. I'm not saying.
And then, to add in another factor is the school bus. So I ride a bus, well, I mean, that's 6 through 12.
But is that, but where are the quarantine kids coming from? Is it from the bus? Is it from a sibling? Is it from
all.
them being in a class that they're supposedly all wearing masks in and not, we shouldn't be 6 feet away, even though he changes classes 5 times a day.
Right.
If that kid is 6 feet away from me and he's wearing a mask, like I hear they are, and they are, why is the rest of the class quarantined?
If they're 6 feet, they shouldn't be quarantined unless it's a pre-K class or sometimes our special needs, self-contained classes. And when the age level, you know, when you're in kindergarten, the teacher ties your shoe and
Right. Oh, yeah, my
you know,
wife's in
things-
quarantine now for that.
yes, and say, yes, yes,
So we hadn't figured it out, but the number is of the quarantine kids catching it is low. I mean, it's,
yes, we don't see a lot of the kids, you know, you could argue that both ways, why are you quarantining, they're not catching it, well, you could argue that, well,
right.
they're quarantining, so they won't catch it.
Fine.
And what we're trying to avoid is the cluster, so say I test positive and all of y'all are exposed and you get, I mean, we're trying to avoid that setting. You know, what the CDC recommends, congregate settings, which a school is social distancing. The problem with social distancing though, if you have people 6 feet apart, you can put about 7 students in a classroom.
So they're not, okay. So they're not-
I mean, there's just no practical way to make that happen. So from the beginning, we've said, you know, we wouldn't be able to maintain the social distancing. So when the new guidelines came out, we were excited. We're like, yes, 10 days. This is great. It's a game changer. But when we got to looking at it, there was no practical way to make that happen. Because we thought, well, we could put them in a room and they'll just be in that room with other, but then you'd have to do like a gym or something because of the numbers. So it's and I know it's very frustrating to parents. I've been in conversation with parents whose children have quarantined 2 and 3 times. Kids are missing ball games in the start of their season, and that's a shame. You know, we wouldn't wish that, or they're missing, you know, the in-person academic setting. But thankfully, with virtual learning, we can continue providing instruction and hopefully keep the child on track and up to speed. And perhaps things will improve. Gosh, when you look at our numbers, if you go to that EPH website, don't pull it up, Jennifer, but if you go back and look at Lee County numbers from we had a real uptick right when school started, but then I saw a copy of the Lee County Ledger. I was cleaning some stuff up at the house and it said Lee County Schools report 0 cases. And we had that. Then the next day we got like 7 because the headline, you know, we feel like we're making progress. So our goal is to have school in person and to do it as safe as possible. All options are on the table. We will certainly consider, I know some have advocated for having different standards for the different age groups, but you know, that's certainly something we'll look at. I'm thankful for a lot of smart people who are giving us advice and counsel, and they really helping us think through these decisions. So.
Last question.
Yes, sir.
Is gonna hit to several areas, I guess, but I heard this morning, I don't believe anything the news says, but I happen to hear it. That it may take, even at the rate we are vaccinating people today, it could take a year to vaccinate what they feel they need to have vaccinated for herd immunity. Are we gonna continue? How long? Or are we going to do it again? Continue to let these teachers that feel that they are at a higher risk or whatever, stay home and teach and continue in the next year? Are we making plans to help this? Because that's part of our substitute problem, right? Is that a substitute is in a room that a teacher is not going to be here.
Well, we really have very few that are teaching from home. And
Oh, we don't have any? Okay.
well, we have some, but it's a very low number. Yes, that we require to put a substitute in that room so they can teach from the safety of their home. The idea is that teachers are tier 1B, so we're the educators are the next in line for for vaccination. And, so we should be able to make it pretty safe with the vaccination for people to come back into the school setting. And my hope is somebody, I talked to recently had been in a conversation with the governor, and this is a healthcare leader, and they said possibly February to begin teacher vaccinations. It's really gonna depend on the supply of vaccine. So that's wonderful if that transpires.
Well, I've heard different pharmacists tell me different things. Some, you can just go in there and say, I'm a caregiver. I mean, which a teacher is,
Right.
and they can get vaccinated. I think some aren't discriminated. If you want the vaccine, they're gonna give it to you. I think the health department, some of them are being a little more stringent on.
Well,
which
you
I'm
know,
fine.
there's a case that
Mm.
happened in Georgia where a school system got all their teachers, they worked with a local medical provider and got, not all their teachers, all that wanted to participate vaccinated. And, they stopped supplying the vaccine to that provider in that community.
Cause he was doing everybody.
Well,
Yeah.
some people got ahead of the line. so
Yeah.
to speak, And
Well-
we think it's important for educators to be vaccinated, and there's a lot of talks going on with the governor and the superintendent association, the Georgia School Board Association, the principal associations. They, believe me, he's hearing, and I think he's wanting that to happen, but we've got a process to work through as a state.
So the last question is, if a teacher comes to you and says, Dr. Miller, I'm scared I'm gonna catch corona, take the vaccine. I'm scared to take the vaccine. I wanna continue working home. How is Lee County gonna handle that?
We will address that on an individual basis. And
But it will be addressed.
yes, sir. We will not be, a teacher asked me this last week, are we gonna mandate a vaccine?
I'm not saying mandate it, but when somebody's
Right.
scared of catching something and there's an alternative over here.
Well, the community where the vaccine was given to the teachers, my understanding, only about 40% of their staff participated. I know there's people that have questions and concerns about it, and I understand that, and, you know, I don't see us being in a position to mandate, but we'll be okay. Let me just say that. We can handle that, and it will be fine. We are concerned about the health of our staff. That's a big concern. You know, we've been fortunate that the cases that we've had in the system, everybody's done fairly well with it. There's been some challenges, but so far it's gone well, and that's my hope and prayer as we move forward with our staff safe and our students, of course.
Is that the last question?
That was it. I'm sorry. I had several throughout the thing, I just figured out all that.
You said it twice.
I said it last part. Yeah, I'm sorry.
Anybody else have questions for Dr. Miller this way?
I should say it.
Let me say this, and I know this is not what Dr. Newell was indicating, I'm not at all saying that, but for the most part, as I was listening to the radio again, all I hear is about larger city school systems being held hostage by certain unions and certain other organizations that are keeping schools, quite frankly, from being open. The attitude of this administration and the teachers in the Lee County school system and this board from the beginning has been, we're gonna open our doors and get our students back to school, and I personally can't say thank you enough for that attitude and that drive. Yes, we've had some bumps in the road and we've adjusted, and everybody that I can think of that's tied to this system has stood up and said, here I am, send me, let me do what I need to do to make education effective in Lee County. And I, for one, say thank you. I spoke earlier for the whole board without a vote. I probably shouldn't have, and I kind of think everybody in this room agrees with that statement, but I'll tell you that's for me.
Well, and I don't wanna think any
The question I'm asking is to mean the alternative.
No,
I
I
totally
know
agree
that.
with Mr. Griffin, you and Frank there. I just don't, I'm asking these questions because some of them, they're from my knowledge.
I have those very same concerns you have, very same.
All right, anybody else? Next item on the agenda is a request from Mr. Haynes for us to authorize the purchase of 2 buses, 14 passenger buses. I believe the total expense will be around $130,000 for the 2, is that right?
It was 64, so a piece.
Yeah, yeah. All right, what's the pleasure of the board as it relates to this request?
Motion from Ms. Lang, is there a second?
I'll second it.
Second from Mr. McDowell, any discussion?
I've always wondered why we didn't have some smaller buses for smaller activities. I think it's gonna be beneficial for the school system and cost effective, not be running a large bus around. So I've always wondered why we didn't have those.
Thank you. Ms. Ford?
This Bluebird usually makes all of our buses. I'm not familiar with this name.
That's the chassis company, I'm sure. I don't have, I hadn't read it in a week. What's the name?
Yancey, they're the salesperson for Bluebird.
It's gonna be the microbird, just like one outside that window.
Okay. Does that not come in a diesel? It only comes in gas? Or are we just not getting it in a diesel?
Well, I didn't check on that, but I mean, I wanna say when we bought that one out there, they were gas, but I don't know. I mean, the gas are cheaper, but I know diesel lasts longer, but
But we don't have.
I'll check. I mean,
We don't have pumps for gas, do we?
yes, we do.
We have pumps for gas?
Yeah, for maintenance and stuff like that, they're out there.
Oh, okay. Okay, I just think buses are supposed to be diesel.
And we're paying for this from the, these ain't, they're not buses.
Well,
These are big
they're
quality
yellow,
vans.
And they have green seats. They're buses.
They're legal vans. And we're paying for this with the upswing in the SPOS fund.
Any other discussion?
Hearing none, all those in favor, let it be known by saying aye. Aye. Any opposition? Passes 5-0. Ms. Lang, I believe you have a recommendation for us.
I move for the board to go into executive session to discuss or deliberate upon the appointment, employment, compensation, hiring, disciplinary action, or dismissal, or periodic evaluation, or rating of a public officer or employee, or to interview applicants for the position of superintendent.
We have a motion for executive session. Is there a second? Second from Dr. Newell. All those in favor, let it be known by saying aye. Aye. Any opposition? We will not take up any other business when we come back from this session, so the public can know we won't do anything while break.